Okay.
Hi there, and welcome to the second flipped lecture. This week is going to be on the welfare state and the NHS. The NHS is something that many of us take for granted and can really play an important part in our lives. But how did it come to be in the first place?
To understand what happened, we need to go back to 1911. At this time, there was a Liberal government led by David Lloyd George. The government started to become aware of health problems that faced ordinary people. Think about how this is different to the laissez-faire attitude that we saw with governments in the 19th century.
One of the big problems was what happened when a worker was sick. This led to the government introducing the National Insurance Scheme in 1911. What happened was that workers and employees made weekly contributions to a scheme which gave them access to sickness benefit when they became ill, and also the opportunity to visit a doctor.
You probably agree that this sounds a pretty good idea, but there were some problems. This scheme was limited to those that were employed, which meant the following groups weren't covered: women, children, the unemployed, the elderly and the mentally ill.
During the 1930s, Britain suffered a depression, which meant that lots of people were unemployed and couldn't get access to health insurance. People couldn't keep up their payments, and the government was unwilling to give greater financial support to the system, with them only paying 5% of the costs towards health services in 1938 and 1939.
As people couldn't afford to get help from the doctor, they often relied on traditional methods or ideas passed down from the family. For example, putting goose fat on their chests if they had whooping cough. It sounds unpleasant, and the other thing was, there was no guarantee that it actually worked.
Things took a step forward when Britain became involved in World War II. This is something that you'll notice in the next part of the unit. Although war is an unpleasant thing and nobody wants it to happen, it often brings about medical change.
The government knew that it had to develop medical services to protect against the large number of civilian casualties. But their minds also turned to what was going to happen after the war.
In 1942, a civil servant named William Beveridge put forward ideas about a free national health service. People said that this would provide free for people from the cradle to the grave. The ideas were that people would pay taxes would give them access to medical help whenever they needed it.
Apart from being available to all people, the idea was that it would also cover different types of possible healthcare. The NHS would be run by the government, and that would then cover everything from maternity and child welfare to family doctors, and also to issues like blood transfusions. It was a completely revolutionary idea.
The responsibility for introducing the NHS fell to the Labour Party, who took over power in 1946. They introduced the National Health Act. In 1946, the health minister was a man called Nye Bevan. He was an ex-minister from South Wales and was passionate about making the NHS work.
There was a lot of resistance to his ideas though, as there often is when people are introducing ideas of change. We refer to this resistance as conservatism. Firstly, lots of people were worried about the cost, and they argued that it was going to be too expensive.
Secondly, many of the 3,000 hospitals in Britain didn't like the idea of being taken over by the government. We call this being nationalised. There was also resistance from members of the British Medical Association, the BMA, who represented doctors. Doctors were worried that working for the government might affect their income. So what did Bevan do?
Well, first of all, he used his personality. He was a strong and powerful individual, and he started to win people over. He was also clever, and he promised consultants a salary and allowed them to treat private patients in NHS hospitals. Resistance crumbled, and by July 1948, 90% of doctors had enrolled. 6 months earlier, 90% of BMA members had been refusing to cooperate. This was a victory for Bevan, and the first patients were treated on the 5th of July 1948.
One of the priorities of the NHS was to help women who Bevan believed suffered. The terrible levels of maternal mortality started to fall. The role of the local GP also improved, and they were able to work in teams to provide a range of health services.
However, it's important to remember that there were some problems, and some compromises had to be made. Prescription charges were introduced in the early 1950s, and charges for dental treatment were also introduced.
Today, you often hear complaints on the news about the situation with the NHS. For example, that waiting lists are too long, or that there are not enough hospital beds. But the fact remains that it costs less and helps more people than in a lot of other systems.
So hurrah for Bevan and those that had the foresight to introduce the NHS after the World War II. This wraps up our second flip lecture on the NHS. Hope you found it useful, and remember you should use this to try and make your own notes and to be fully prepared for the next lesson. Pause, rewind, repeat us whenever you need, and remember you can find us on Kite and through the YouTube link which has been emailed to your school email address.